Does your lower back shoot with pain when you bend down to tie your shoes? Don't rush to blame your age. The truth is, your lower back pain comes from a stiff spine that's lost its natural movement, not from getting older. Here's the good news. With just ** 10 minutes a day. No equipment needed. You can * reduce pain, move more freely, and protect your back for the long term. In this video, you'll learn * 5 simple movements * that physical therapy experts have trusted and used for nearly * 100 years. Do them correctly, and you'll feel the difference * from the very first time. Cat-cow is the single most important foundation movement in any lower back pain relief routine. This should always be the first exercise you do, because its job is to wake up and lubricate the spine, especially the mid-back and lower back. The areas that often become frozen from prolonged sitting, lack of movement, or poor sleeping positions. When these spinal segments lose their ability to move freely, the body is forced to compensate. That's when pain shows up, when you bend forward, stand up, or rotate your torso. Cat-cow works through the spine's natural flexion and extension, guided by breathing. As you inhale and move into cow, the spine gently extends, the vertebrae separate slightly, blood flow increases, and the discs receive nourishment. As you exhale and move into cat, the spine flexes, tension is released, and the nervous system shifts into a calmer state. This smooth back and forth rhythm helps your spine remember how it's meant to move. How to do it correctly. Start on all fours. Hands under shoulders. Knees under hips. Spine neutral. Inhale through your nose. Let your belly relax. Gently arch your back. Open your chest. And lift your head, cow. Exhale slowly through your mouth. Round your spine upward. Draw your belly in. Tuck your chin toward your chest, cat. Move slowly and smoothly. Each phase should take about 3 to 4 seconds. No jerking. No rushing. Common mistakes. A very common error is creating movement from the arms or shoulders. Remember, your hands and knees are only there for support. The movement must come from the spine. If your shoulders feel more tired than your back, you're likely doing it wrong. If getting on the floor isn't an option, you can do cat-cow seated on a chair, using the same spinal flex and extend motion with the breath. When to practice? The best time is in the morning, right after waking up, when the spine is stiff from the night. Just 10 repetitions can help your back wake up before the day begins. It's also an excellent warm-up before exercise or anytime your back feels tight during the day. Progression and results. Start with 10 reps. After 1 to 2 weeks, increase to 15 reps. Most people feel their back become lighter and more flexible within just a few days. As spinal movement returns, dull aches and that locked up morning stiffness begin to fade. This is the foundation of lower back recovery. Get this right, and everything else becomes easier. After your spine is warmed up and moving smoothly with cat-cow. Child's pose is the next step, a moment of deep release and true decompression. If cat-cow restores movement, child's pose lets your lower back fully rest and unload. This position is especially powerful for people who feel a dull ache just above the hips. Pain that builds up by the end of the day after long hours of sitting or standing. In daily life, your lower back works non-stop to keep you upright. That constant effort creates prolonged compression on the vertebrae and discs. Child's pose acts like a reset button, allowing gravity to gently stretch the spine lengthwise. This helps relieve that heavy, deep tension many people describe as pain from the inside. That's why so many feel immediate relief the moment they settle into this position. How to perform child's pose. Comfort comes first, never force the shape. From an all-fours position, gently shift your hips back toward your heels. Extend your arms forward with palms resting on the floor. Let your chest soften toward your thighs. If possible, allow your forehead to rest lightly on the mat. Once you're there, Simply breathe slowly and evenly, letting your body melt into the position. Important adjustments. Child's pose should never cause pain or discomfort. If your hips don't reach your heels, place a pillow or folded towel between them for support. If your forehead doesn't touch the floor, stack your hands and rest your forehead on them. These adjustments do not reduce the benefits. In fact, they help you relax more deeply, which is the true purpose of this movement. How long to hold? Start with 30 seconds, focusing on slow breathing and the sensation of your lower back softening with each breath. After 1 to 2 weeks, you may increase to 45 seconds or up to 1 minute. As long as it feels good, there's no need to count precisely. Just don't rush out of the pose. When to use it? Child's pose fits almost anywhere. Right after cat-cow, the body is already in position. In the middle of a stressful workday. In the evening before bed to calm the nervous system. Many people notice that with consistent practice, the feeling of compression and end-of-day back fatigue significantly decreases within just 1 week. Over time, child's pose does more than reduce pain. It teaches your body how to truly relax. Instead of constantly bracing the lower back, this is a key piece of long-term spinal recovery, especially for those dealing with lower back pain from a sedentary lifestyle. Slow down, breathe, let your spine recover. Supine spinal twist restores rotation, the most overlooked movement of the spine, yet one of the most important for reducing and preventing lower back pain. Most daily activities happen straight forward and back, sitting, standing, walking, bending. When your spine loses the ability to rotate smoothly, pressure builds up in fixed spots. That's when sharp pain shows up as you twist, reach, or change position suddenly. This movement targets the quadratus lumborum, a deep muscle on each side of the lower back. It commonly tightens from long sitting, uneven posture, or carrying weight on one side. When it's tight, pain often appears more on one side and worsens with side bending or twisting. Supine spinal twist gently stretches this muscle while allowing the lumbar spine to rotate safely and without load. How to do it? Lie on your back on the floor or bed. Extend your arms out to the sides in a T shape, palms facing up. Bend one knee. Start with the right, and gently guide it across your body toward the left. Don't force the knee to the floor. Let gravity do the work. Keep both shoulders as relaxed and close to the surface as possible. For deeper release, turn your head in the opposite direction of the knee. If the right knee goes left, turn your head to the right. This balance stretches the spine from lower back to upper back and sends a strong relaxation signal to your nervous system. Hold for about 30 seconds, breathing slowly and calmly. Then return to center and switch sides. Key reminders. If your knee doesn't touch the floor, that's completely normal. Never push or press the knee down. If the stretch feels too intense, place a pillow or rolled towel under the knee for support. Comfort increases effectiveness. When to use it? Right after knee to chest, while you're already on your back. Before bed to calm the body and nervous system. Midday to reset your spine, especially if you sit for long hours. With regular practice, rotation becomes smoother, sharp pain when reaching or twisting fades, and the lower back feels more balanced instead of pulled to one side. After 2 to 4 weeks, many people notice clearer, freer movement with far less discomfort. Supine spinal twist completes the picture, helping your spine move in all directions. Not just forward and back. Move gently, breathe deeply, let your spine do what it was designed to do. Knee to chest is one of the most classic, and most effective, movements for relieving lower back pain. It's especially helpful if your back feels tight when you bend forward or when you stand up after sitting for a long time. This isn't a new or complicated exercise. Doctors and physical therapists have recommended it for decades because it safely and gently releases pressure from the lower back. In your body, the hip flexors and the muscles along the lumbar spine are closely connected. Long hours of sitting, especially with poor posture, cause the hip flexors to shorten and pull the pelvis forward. This increases the arch in the lower back and places constant stress on the spine. Knee to chest brings the pelvis back toward a neutral position, reducing unnecessary tension and allowing the lower back muscles to relax. How to do it? Lie on your back on the floor or on your bed. Extend both legs and let your back rest naturally. Slowly bend one knee and bring it toward your chest. Hold it gently with both hands, either behind the thigh or over the shin. Whichever feels more comfortable. Pull the knee in only until you feel a mild, comfortable stretch in your lower back and hips. Never yank or force the movement. Hold for about 30 seconds, breathing slowly and deeply. Keep your lower back gently pressed into the surface beneath you. Don't let it arch excessively. Then switch sides and repeat. After both sides, you can bring both knees to your chest at the same time for a deeper stretch across the entire lower back. Hold this version for 30 seconds to 1 minute, depending on comfort. Common mistakes. The most common error is pulling too hard, which lifts the lower back off the floor and creates discomfort. Remember, this exercise is about relaxation, not effort. If reaching your leg is difficult, use a towel, strap, or belt around your thigh to assist. Range of motion doesn't matter. Comfort and safety do. When to practice? Knee to chest works best. After child's pose, when your body is already relaxed. In the morning or evening, when stiffness is most noticeable. Anytime during the day when your lower back starts talking to you. Many people feel relief almost immediately, even after the first session. With consistent practice, knee to chest helps you bend more easily, stand up with less effort, and significantly reduces that dull, lingering lower back pain. This movement bridges the gap between simple stretching and restoring natural balance to the lumbar spine, laying a strong foundation for the rest of your back recovery routine. Slow, gentle, effective. Your back will thank you. Pelvic tilt, also known as deep core activation, is the final, and most important, step in the entire lower back recovery sequence. If the previous 4 movements focused on releasing tension, stretching muscles, and restoring motion, pelvic tilt does one critical job. It locks in and protects those gains. Many people stretch but never activate their muscles, which is why lower back pain often comes back. Pelvic tilt acts like a safety lock for your spine. Most lower back pain exists because the deep core muscles, especially the transverse abdominis, are weak or inactive. When these muscles don't do their job, the lumbar spine absorbs all the stress every time you sit, stand, bend, or lift. Pelvic tilt retrains your body to use the muscles designed to protect your spine, so your lower back no longer carries the load alone. This exercise isn't about strength, it's about control and awareness. How to perform pelvic tilt. Lie on your back on the floor or bed. Bend your knees, feet flat on the surface, hip width apart. Your lower back should rest naturally, leaving a small gap between your back and the floor. From here, gently tilt your pelvis and press your lower back down as if you're trying to erase that gap. At the same time, lightly draw your belly button toward your spine to activate the deep core. When done correctly, you'll feel your lower abs engage, while your glutes and thighs stay mostly relaxed. Hold this position for 5 seconds, then fully relax and return to neutral. That's 1 repetition. Perform 10 slow, controlled reps. Common mistakes. A very common mistake is using the glutes or lifting the hips. Pelvic tilt is not a glute bridge. If your hips come off the floor or your glutes squeeze hard, you're doing too much. A simple check. Place one hand under your lower back. When you tilt correctly, you'll clearly feel your back press into your hand. If not, reduce effort and focus on the small, precise movement. When and where to practice. Pelvic tilt can be done anytime, anywhere. In bed in the morning. Before sleep. Sitting in a chair. Standing with your back against a wall. It's the perfect exercise after stretching, helping your body remember proper alignment when you return to daily activities. Progression and results. Start with 10 reps, holding each for 5 seconds. After 1 to 2 weeks, increase to 15 reps or hold for 10 seconds if comfortable. Many people notice better sitting and standing posture within just 1 week, with less fatigue and pain by the end of the day. Pelvic tilt isn't just an exercise, it's a foundational skill. When your core works the way it's meant to, your spine becomes more stable, and the risk of recurring back pain drops dramatically. This is how you make recovery last. Strong core, stable spine, confident movement. You can apply these **5 movements** in 2 very flexible ways. Option 1. ***, perform all 5 exercises in sequence for about **10 minutes a day. The best times are * in the morning after you wake up or * in the evening before bed. This gives your spine a full reset and sets your body up for the day, or helps it fully unwind at night. Option 2. ***, if time is limited. Simply choose *** 1 to 2 movements * that best match how your back feels right now. Do them throughout the day, especially * after long periods of sitting * or whenever your lower back starts to feel tight or stiff. When done correctly and consistently, many people feel their back become lighter * after the very first session. After * 1 to 2 weeks, pain with bending, twisting, standing up, or sitting down usually decreases noticeably. By * week 4, the lower back often feels more stable, less tired at the end of the day, and far more flexible. Most importantly, you'll start holding better posture * automatically, without forcing or bracing. If you've tried these movements, leave a comment below and share what changes you've noticed. It helps others stay motivated. Don't forget to like the video if it helped you. Share it with friends or family dealing with back pain. And subscribe to the channel so you don't miss future videos designed to help you move strong, pain-free, and confident everyday biceps.